appreciate you joining us today. We've got a couple people in here, and then we're streaming this on Facebook, and we're streaming it a couple places. And so what we'll do primarily on this call, Stephen, is we'll take the first 20 or 30 minutes, and I'd love to just explore your journey as a practitioner and your journey with StemWave and what brings you to seeing, as you told me this morning, literally 30 patients this morning. And so just how we arrived at that circumstance. And we'll take the second half of the call. I've got a list of questions that people have asked us throughout the week, and I'll want them to be answered by you. And then I'm sure we'll have questions that come up from people, whether it be on Facebook or here in Zoom, and they can just drop them in the chat, so we'll answer them then. But I'll let you introduce yourself and just tell you a little bit about tell me a little bit about like where you are right now, where you're taking this call, what type of doctor you are, and all that good stuff.
So it's 30. I did 30 treatment areas today, not 30 patients, but I did probably 30 patients altogether with adjusting them and stuff. So my name's Dr. Steve Wechsler. Here in Syracuse, New York. I've been practicing almost 36 years now, and now I have more new life to practice another at least 10. And so I went to Palmer. I came out of school a fairly straight chiropractor, taught chiropractic around the country with Donnie Epstein. People know from Network Chiropractic, but I really needed just a candle to work in my office. I didn't need electricity. We've worked without heat. We've worked without lights. But then in 2012, I had a pretty big car accident. I got T-boned at a light, and I couldn't walk or work. I had 2 surgeries, 300 therapy appointments, but it got me to try other things. Light therapy, laser, really allowed me to work about 10 hours a week. Beamer got me back, like feeling great again. And then I was gonna I was working on my sailboat, and I stepped in a hole and fell over my ankle. The neighbors probably thought I broke my ankle. It was so loud. And I got up gingerly, had some friends there, finished the boat, but a month later, I could not walk on that ankle. It swelled up so bad. I was supposed to cover a friend's office in Watertown, New York. And I said, hey, I can't work today. I can't even walk. And he said, oh, you got to come up here. We're doing a new kind of therapy. And I went up, and they worked on me for literally a few minutes with a different machine, but I could walk. And then I watched the Amish walk in and walk out straight. And I like blew my mind, because I've been covering this guy's office for 36 years. And I spoke to some people about it, and I did some research, and then I found StemWave. And I was like, oh, wonder what this is all about. So I did my homework. I was visiting my son in Baltimore, right near a Dr. Alan Madison, who does a lot of the scientific stuff for StemWave. And he really showed me why to buy this machine at this particular time. I was one of the early in the game buying a machine. I sat with Alan twice at his office in Columbia, Maryland. At that time, it worked out. He came up, trained me and some other people. But what the amazing thing was, 3 days into using it, I had a woman with a 50-year frozen shoulder. She had a car accident at 14 years old. She couldn't even flip a pancake. That's how frozen her whole arm was. She's 68 years old. I worked on her the first time. So with very little, my 3rd day using it, with very little education, practice, this was a patient of mine for 20 years who I've helped immensely. So she was super happy with me as a chiropractor, and her arm didn't move. She had it manipulated under anesthesia twice, like nothing was working. I did the StemWave treatment, wasn't really painful at all. I said, how are you? She said, I don't really notice anything. Then I called her the next day. She didn't notice anything, and I called her the next day. And she came in for her second treatment, and she lifted her arm. Well, she didn't know it. She lifted it with the other arm because she had no strength. She didn't know it moved, except something dropped, and she reached out for it. So a mind-blowing miracle. Her second treatment, we moved her arm 360 degrees. She walked out of here not able to really talk, walked right past her husband in the waiting room and out to the parking lot. And her husband was like, is she okay? I said, well, talk to her, she'll tell you what we did. So I have those miracles, not like when I did just chiropractic, I'd have miracles. Yeah, once a month, with just a small child and they could walk and talk again, like miracles. I have that every single day, if not once a week, since I've used this for a year and a half. I've had these miracles. And so I'm working 3 hours more a day. I work 2.5 days a week. I work 3 hours more on Monday and Friday just to handle the amount of people coming in. Most of my people come from, I do no advertising. I've never done any advertising in my office. I have a newsletter, but all it has is an article on StemWave. So these are direct referrals from people's results. And I have a medical doctor who sent me now over 50 patients. The first 36 years, maybe 2 patients from medical doctors. I've had a huge amount of people who have either delayed or canceled surgeries, not because I told them to do that, because they said they're going to do that because they've had such dramatic results. I've treated people as young as 15. I've treated people as old as 104. And every day I'm blown away. So
that's incredible. I mean, I literally have so many questions based on everything that you just said, but I'll start with all of this happened. I mean, how long ago was it that StemWave arrived at your office?
It was a Christmas present. So a year and a half ago in December, right? Because I needed to spend some money for tax reasons. So it was perfect. I bought the machine, wrote a check. It was the easiest money I've ever spent. And it has brought me, I bought my second machine, like the next year.
Yeah.
I bought a second
and
machine.
Every year after that.
And I put I put a 1.5 million waves on my first machine.
It's literally, and like today, I guess the first question I have is, how's your ankle?
Oh, I didn't have a problem after the first treatment.
And today, still no problem.
No, and that's the thing. I adjusted probably 5 or 6 people today who had their StemWave treatments months ago, and they're still thanking me about it. And they haven't had a treatment since.
So that's a concern that a lot of people have. And I think a lot of the reason people have that concern or that question is because the research goes, the furthest research paper we can find is tracking up to 24 months. But in our own personal experiences in the offices that we work with, I mean, it's pretty incredible. So I'd love for you to just talk a little bit about, how do you see it in terms of, you see really great results in the first visit? How does it work visit by visit? And then what do you see long-term? Because you've had this for almost 2 years now. So what have you seen and experienced?
So a year and a half, almost to be exact.
Yeah.
And so first visit is the amazing visit. I would say 90% of the people on the first visit are like, wow. Now, wow's different for people. Wow is, on the second visit, this woman moving her, I had to move her arm because she couldn't move her arm like that. She had no muscle tone. So let's go, this is what I do with patients. They're like, what does it treat? And I go from top to bottom. I've had neuropathy patients. Now, neuropathy, as a chiropractor, impossible to hard, even with the light therapy, with the laser. Did I have results? Yes. 82-year-old guy, first neuropathy patient I treated. And again, I remember when Alan said, or Dr. Barton, don't do neuropathy patients in the beginning. They're really complicated. 82 years old, first treatment. Putting the gel on, the guy was jumping on the table. That's how much the gel bothered him. Moving the instrument to move the gel around, he goes, oh, turn it down, turn it down. I'm like, it's not on. That's how crazy his feet were. The treatment was like nothing. Treatment didn't bother him. And he got up and he could feel his feet. He said he felt like a teenager when he left. Now that's pretty remarkable. But I have many women in their 80s do their first squat in 10 or 20 years. I'm like, oh, squat down. They're like, I can't do a squat. My knees, my hips, and they do it. I put up 2 chairs. And I am in the room that I did all those treatments in. It is 8 by 10. You don't need a lot of space. I have a hydraulic table only because the health food store closed down and I got it really cheap. You don't need fancy tools to make this work. So neuropathy, I had a gentleman, 68 years old. He broke his ankle when he was 6 years old. His parents put him to bed because they were poor. He got into karate. He's quite overweight. And he was pretty good in karate, but he could never get his second black belt because he couldn't jump on that leg. He had no more than 6 treatments. His foot was black, turned pink. Now it's down to not fully normal size, but he got his second black belt at 68 years old.
That's incredible.
Incredible. Knees are like the easiest thing in the world. I just had the second to last patient was a knee sprained in tennis. She's 77 years old. I take care of a lot of older tennis players. And she came in originally because her frozen shoulder. So not only did her frozen shoulder change, but even the amount of scoliosis she had in her upper back. Now, I wasn't treating the scoliosis. I was treating the shoulder. And that allowed her more movement. But she had hurt her knee, which she gets gel shots in every 3 years. Now, if she just hurt her knee the day before, I wouldn't have treated it with StemWave. I'd probably use laser, things like that. But she's got this chronic condition. Hips, I've had more chiropractors send me their mother-in-laws, not their mother, their mother-in-laws, to have their hips done because they're looking at surgery. Now, does that mean everyone I treated didn't get surgery? Absolutely not. But I had a guy, I did his hip. I was early on. It wasn't really as good of it as I am now. We treated his hip, and it worked somewhat. He was somewhat better. But when we treated his hip before his surgery, which was 6 months later, he walked into surgery pain-free. And the doctor mentioned that he couldn't believe how bone on bone he was and almost no inflammation around it. So that blew me away to have that kind of evidence right there.
No wonder he's referring to you.
Yeah, and then that was a different doctor referring to me. Then we treat sacroiliac pain. We treat lumbar spine, but not on the spine. We treat away from the spine. I work as safely as I can imagine around patients because we don't want any negative side effects. So I work around the sacrum. I work around the top of the iliums. I do shoulders. Shoulders are another ones. They're more complicated. I just had a guy tore his supraspinatus, bunched up in the back of his shoulder. But I examined his shoulder and I looked at the MRI. It's an acromial problem. And we worked on the acromion, which has tons of spurs on it and stuff after examination. And he could move his arm, even though he couldn't move his arm before that. So maybe it's not the supraspinatus that his problem is. Maybe it's his acromion. Because I'm not going to make that supraspinatus attach again. But he's thinking, well, I'm going to do this because I'm going to walk into surgery feeling great. Because nothing's going to attach that except for surgery. But he's got to look at his lifestyle. He's 73 years old, dives and works on docks underwater. Like, pretty physical guy. We do some work in the cervicals, but not a lot. We try to stay kind of lower part of the cervicals, but we've had good results there. And again, I've treated people. I treated a 104-year-old patient, the oldest patient I've ever had, referred by his medical doctor, broke a vertebrae 10 years before and walks with a walker. And he walked out of here feeling great, never came back. So I called him and he says, oh, I don't need to come back. I'm feeling fine. And I said, you're 104. You can do what you want, So I don't, 10, 12 treatments is at the most I treat people, but most of my folks are getting 6 or 8 treatments and feeling like, wow. Frozen shoulder, she comes in once every 4 to 6 weeks. Why? Because she's afraid it will come back. I don't tell her to come in every 4 to 6 weeks. She just comes in. I treat a lot of different populations of people, young athletes, but again, we use laser and sometimes we use StemWave. I'm still the chiropractor. Just because people come in wanting this, I'm still examining, I'm still adjusting. Many people come in, they go, oh, you're a chiropractor? They don't even know. They're coming in because of the machine, not for me personally. I do all the work. I do all the work myself. I haven't hired someone to use it because you miss out on all the fun. I have fun all day long. I did not have a break from 8 a.m. till 1 p.m. Before I would start at 11 and take a 2-hour lunch break. They don't exist anymore since StemWave.
What do you feel like makes you love it so much?
Well, two things. Number one, I'm playing pickleball twice a week for 3 hours at a time without any pain in my ankles and my knees and my hips and my shoulders, which used to bother me at times when I did sports like that. But they did bother me, but I'd recover by the next day. And I hit it, either hit it hard in the office. I still cover people's practices. So I'm 60 years old and almost 36 years into practice. And so it's helped me big time. And most of the people that I took care of at first were all patients of mine. I've already been seeing them. So they loved me for what chiropractic, what laser, what beamer, and then they were like blown away that their knee could actually work, their ankle could actually work. Not that I wasn't doing a good job before, it wasn't enough.
Older device.
So,
and
Right.
there we go.
so I have a question for you. A lot of people, like, I'd love to know, because now I feel like every time I speak to you, I feel like you have to pencil me in for 2 minutes because you're like between two StemWave patients. Like even this webinar, I'm like, is he going to make it on time? He's got
One person we had to ask to come back.
Did you? Like I said, you hopped on 10 minutes before and you're like, I'll be back on in 10 minutes. I have to go take care of a StemWave patient. So I want to know, like, tell me how you run that initial visit. Like, how does that go? You said it's a magical visit. What makes it so magical? How do you run that visit? What's happening?
Let me tell you first how I run my practice, which is different than most, is we only schedule new patients. Everyone else just drops it. So you need a therapy that is fast and effective. You need a therapy that you're not need to talk to people for 10 minutes before their treatment and 10 minutes after. This is the perfect treatment. The results do the work. So new patients come in, they have filled out my full paperwork, they get an exam, then we concentrate on the area that they're coming in for. And again, some of them are referred here just for StemWave, and that's not what they get because that's not what's needed at that point. Sometimes it's a few visits in, they start their StemWave routine. They come in, I examine the area, and I ask them the one important question: what can't you do with it? And then I'm like, well, what if you could do that? They're like, oh, I can't walk stairs. And we have a set of stairs because I have a home office. So we have a set of stairs. So I'll ask them to expose the joint. And while they're doing that, I go adjust 2 or 3 people, sometimes change some therapies. And I walk back in and literally and I give them the article. So they'll read the article. That gives me some time to work on other people. And then I'll come back and I literally give them a 2 or 3 minute treatment. And I say, okay, let's go walk some stairs. And we go to my staircase and we walk some stairs and people are just, oh my God. Or we do some squats, or we do whatever they can't do right there. And they're blown away. And they come back twice a week for 2 weeks, once a week after that. Do I do some people through 3 weeks? Some people twice a week for 3 weeks, but not often. It's not needed. And then they come once a week, and then they're like, oh, can you do my shoulder? Oh, can you do my wrist? When I was a chiropractor, how many people said, oh, I should bring my husband in? Now it's almost 100% of the time their husband comes in, when before, maybe 25% of the time their husband will come on the next visit. They want to come for treatment. So that's exciting. And again, I do not advertise at all. Just have my newsletter that just has the StemWave article. So there's no hard sell. I don't do packages. People pay per visit. It's just because of the way I do it. I don't sit with people for a half hour on the first visit. They get the same few minutes everybody else does before they get their StemWave treatment. I explain it simply as I grab the head and I grab an electrode and I say, right in here, this is where the electrode sits, and this is salt water. The electrode explodes, creates an acoustic sound wave of 3,300 miles per hour. And that, your body, when that goes into your body, your brain goes, I don't know if it's appropriate to say, but I say, oh my God, I've been shot in the leg. And the body goes to investigate it. But it's the only therapy that turns on those toll-like 3 receptors and shuts off the inflammatory toll-like 4 receptors. And that's why they walk out of here feeling great. And I tell them, if your body is injured to the point that it needs that inflammation, your body will turn that back on. But a lot of people, what I've seen in practice in a year and a half, that people walk out of here feeling great, or better, I should say. Then they might get a little rise for a couple of hours or not, but then they sometimes go down and then they come back up. Then I know it's working. If it hurts a bit and then they feel better. If it hurts a bit and then they feel better. By the 3rd visit, they're usually just feeling better and getting better. Now, here's the problem. What do patients do when they feel better? They do the 3 things that brings people into my practice. Gardening. Right now, everyone's like I had a guy, 78 years old. He owns a pipe, drilling and well business. After his 2nd visit, he pulled a pipe out of the ground. He's like, oh, my back is really sore today. I'm like, what did you do? And his wife like rolls her head back. He said, oh, I pulled a pipe out of the ground and then I mowed the lawn for 3.5 hours. I'm like, when's the last time you did that? He goes, oh, since before my Parkinson's diagnosis 10 years ago. So they feel so good that they do stuff. So I have to sometimes read people the riot act and say, for the next 3 to 6 days, you cannot do anything more than you usually do, maybe just a little more. So I say do, but don't overdo. But when you feel good, the 3rd to last patient I had, a very overweight woman, she was having trouble cleaning the house. And I'm like, how did it work? She goes, well, it's pretty good. And then at the end, she told me she cleaned her house for 2 days. Crawled on the floor. She could do that. I said, well, no wonder why you don't feel as good, So, but my best story is I had a guy come in who literally builds rooms to paint fighter jets in. So smart, more money than he need for anything. But he was getting married at 76 or 77 years old to a woman he's been with for 35 years. And he came in a walker. And he's like, I want to walk down the aisle with my bride. And we worked on his feet for neuropathy. Then we worked on his knees for his bone-on-bone knees. Then we worked on his hips for his bone-on-bone hips. And then we worked on his low back and then his shoulder. And he walked down the aisle without his walker, stood for the entire ceremony, and sent in probably 15 people. And that's remarkable. I would never have seen that with what I was doing before. Would I have helped him? Sure, but not like this. I changed his life, which changed my life.
Yeah, you can't make that up. And honestly, it's changed a lot of the ways anybody at the company has like looked at this entire operation that we have here, because every day we get a story from someone that's just like that. And we have so many people who are just, they look at this and they see the videos online, and for some reason it's like, is that really possible, or are those just the cases we're seeing sometimes? And so I'd love to know, like, are there ever cases that it's not a good fit, where someone comes in and they try it and maybe it didn't work the way that you wanted? Like, how does that happen? Or talk to me about that.
I got the perfect story. So this medical doctor who sends in the worst of his patients, of course, like he's trying to.
What are the worst of his patients? Like, give an example. Like,
so here is the woman, like this, with her breathing machine in one hand. Someone drove her there. This was her head. She could not move her head. She had a huge scoliosis, which she had 5 operations on, and she came in for StemWave. And I said, no way. I said, we're gonna use some laser first. And we used some laser, and it helped some. And she goes, I really want to go to Florida this year. And I said, well, okay, and then we used the StemWave on her, So her 3rd visit, she comes back, 3rd visit of StemWave. And she goes, no, and I see her, she's like looking up and talking to me. She's not like this. She's like looking up. And I said, how are you? She goes, well, I went to a luncheon the other day and it was a buffet. And I can't do buffets because I have to carry my oxygen machine. So I took my oxygen off and I walked to the buffet table and I filled my plate and I came back and I was out of breath. I put my oxygen on. She had dropped her oxygen by the third visit by half. I had to actually ask a respiratory therapist what that meant to go from, I forgot, 6 to 3 or something like that. Because it's not always half when you drop at a certain number. So she ended up, after her 8th visit, taking her car with her to Florida on the train. So I haven't seen her back yet. She might not come back. She might be fine. That's the cool thing about this. Patients don't come back because they're fine. I love that. You know, that's not the way I was brought into this profession. You know, I was brought in to manage people, but then I gave that up a long time ago, and I don't have to manage people with this. They want to come back. The guy who got married, he would have came 7 times a week, but I told him he can't. So that woman, I was scared to work on, and great result. And I've had a few people, I've had like a neuropathy patient. So I take care of a local tribe here. There's a Native American nation near here. And I took care of the woman who runs the program that pays for some of their people to come get treatment. And she had severe neuropathy, but she heard from her massage therapist about the 82-year-old guy I told you about who I worked on, whose neuropathy went away. And her neuropathy in 3 visits went completely away. A overweight woman with diabetes, like no way this is going to work. I didn't think it was going to work. She didn't think it was going to work. Regardless,
did you tell her that?
Oh yeah. Oh, you know what? I tell people frequently that I don't know what's going to happen, because I don't. And usually it's much better than both of us think. But I told her, so I treated her 2 or 3 times, and neuropathy went away, and then someone passed away in her life, and everyone gathers around for 3 weeks and doesn't do anything. She stopped coming in, her neuropathy came back, and I couldn't get it to go away again. I have no understanding of why, but that was a learning experience. So I tell people, if you're going to start, you got to finish. But I said, and some people by the 3rd visit, I say, this isn't going to work for you. So they're like, what? I want to do more. Well, you're not getting any results. I usually get results in the 1st, 2nd, or 3rd treatment. After that, I'm like, we got to try something else. But a lot of them fight for it. And rarely, if it doesn't work in the first few visits, it's not going to work in the 20th visit either.
Yeah. And what would you say if you have, I mean, you have like it's seemingly an unlimited amount of patients. It's like the whole Syracuse community is going to your office. But if you see 100 patients, what percentage of them would you say end up being a really good fit for StemWave with your office?
So it's getting kind of funny, because I'm seeing that it would fit for almost anybody, but it's this chronic condition. Sprained my ankle over and over. My knee has been like this for 20 years. Flare up of the lower back. I had a lumberjack guy come in. I mean, he was this way, not frontwards, sideways. I mean, that far bent over. And he was driving to Arkansas, whether he got better or not. So he was that typical patient. He's like, oh, my old chiropractor just, throws me around and I feel better in 2-3 weeks. I'm like, you're driving to Arkansas tomorrow? He goes, yeah, my guys will just throw me in the back, but I got to buy this big piece of machinery for like $250,000. Like, I'm like, well, okay. I said, I have something different. Can we try it? And he said, sure. And I've seen antalgic patients with chiropractic walk out straight, like miraculous, but few. After the StemWave treatment, he walked out straight. He drove to Arkansas. And I called him, and I'm like, how you doing? He goes, oh, I'm fine. And I'm like, well, you're going to come back? And he goes, why? I feel great. Okay. Like, I'm not going to argue with him. I'll see him again when he's bent over again. But so I had a 31-year-old woman come in with her mom for her mom's knee. And she had an episode of severe back pain every few months. Severe. Took me, between laser and adjusting, took me weeks to get her out of it. And 1 round of StemWave, maybe 8 treatments. And I saw her, it was 6 months later. And I'm like, how you doing? She's like, oh my God, you're right, my back, it hasn't flared up at all. Like, I didn't see a lot of that in practice before StemWave. Like people have resolution and feel like they can move on and then live life more fully. But I would say that about myself. I can do things that should, like, I mean, I'll slow down a lot. So, you know, I flipped over a 250-pound generator the other day and my leg was a little numb after, but it went away. That's how patients should be. They do something stupid and they get better.
So we have a bunch of questions to come in. So what we'll do is we'll take the second half of the call. We'll get some of these questions answered. Some have come in the chat right here, some have come on Facebook, and some were submitted via email prior to this. And so these are questions from doctors just like you. Some of them own physical therapy clinics, some of them own a chiropractic clinic, some of them own, you know, pain management clinics, stem cell clinic, whatever it might be. But we'll start with one from David who's in the chat, and he said, what do you charge per session? Is it 6 sessions? Is it 10 sessions? How does that work?
I knew that was going to be the first question. So I do charge less than most, I think. And maybe if that's why I'm so busy, so what? So patients pay between $75 and $100 for a visit, but I do no packages. So 75 is the lowest they're going to pay. But that's per area.
Makes sense. And I mean, I guess to that point, how many areas are you normally doing on an average patient?
1, 2 at the most. So I limit the amount of areas because I've seen people get tired the next day if you do too many areas. But I have a trucker. He's here only 4 to 5 days every 2 weeks. And he had a motorcycle accident. He had 5 separate injuries. So he has cages in his back. He has all this metal and all this kind of stuff. And he would come in and I would treat him, and I talked to Dr. Madison about it. I would treat him sometimes every 12 hours. And it didn't matter. He came home and slept anyway the whole 4 days. Slept and sometimes drank too much. But he now comes in once when he comes in and once when he leaves. This time he only came in once because I've been treating him a number of months. And he feels great. He's ready to ride a motorcycle again. And he rides his bike now during thing. He eats better. He drinks a lot less because he's in less pain. So he would get, let's see, ankle, both knees, shoulder, and elbow. Then we didn't have to do the elbow anymore. And then we would just do much less waves on all the areas. And so he'd get 5 areas and I charge him for 4. Like, but he didn't care. I mean, so what? Like, money was nothing to him because he was in so much pain. And now he's stopping the long haul job and taking a local job because he wants to enjoy his life now.
And you've allowed him to do that, of course. Yeah. So David, to answer that question as well, Stephen mentioned, you know, he doesn't charge much. Maybe that's why he has such high volume. A lot of people charge similar to what Stephen's charging. A lot of other people charge $100 to $200 a session. They charge them as packages anywhere from $1,000 to $2,000 per package per area. So it's a great question. And another question that came in was, you mentioned with a couple of your cases that you often used laser as well. And getting some questions coming in about what's your experience with the difference between StemWave and laser? How are you using them in conjunction? Why don't you just cover your experience with those 2 modalities?
Laser saved my life. Without laser, I might not be sitting here. I would be disabled and retired. So I was a very straight chiropractor. I do some Ayurvedic work. I have doctors from India I work with. But I wasn't getting better. And I had a surgery coming up. First medication I would take since I'm 11 years old was my anesthesia. Like, this was a big deal. And someone gave me some light therapy pads and I used them. Oh, that calmed things down. So then I started working a few hours a day. It would hurt like hell to work. My knee would lock up. I would fall in the office.
Remind everybody what happened that led you to this, to being in that physical
So I had a
situation.
car accident in 2012. I got T-boned at a light with the wheel turned and my foot on the brake, and a car in front of me went across traffic, hit the car this way. That car freaked out, didn't take their foot off the gas, hit me in the rear wheel, broke my axle, pushed me into the next lane. But I had the wheel turned and my foot on the brake because I was going to go around this guy. I knew he was going to do something stupid. And the funny thing was, my son turned his head and goes, "Did we just get hit?" He was on his phone. Didn't even notice that we got hit so hard. But it tore the ligament in my wrist. Now, as a chiropractor, that's not a good thing. TFCC tear, not a good thing. When I tried to adjust the first patient, because I didn't think I was that hurt. But then next 2 days, MRIs, all this kind of stuff. And I knew enough orthopedic doctors that I got in really quickly. But the dye just flowed out of that tear. But between light therapy and laser, I was working almost 10 hours a week in awful pain. I would just lay down in between. My secretary would line up the tables. I would come off the couch and I would work. So laser helped me a lot. And I started using light therapy and laser on patients. And I still have 2 Theralace 50-watt lasers, class 3B. And I got great results. That was the driver in my practice, was laser. People came in for that because it was different. Also adjusting, but that was a different thing. Well, now I use my lasers some. Oh, when Alan Madison told me that, he goes, "Oh, I wonder if you'll use your lasers anymore after this." I'm like, what? So laser I use on acute injuries now for sure, before I use StemWave. And then there are some patients that have been getting laser for years and they love it. And I just do that. I'll do TMJ with laser, occiput, things like that I try not to use the StemWave with, because it's an acoustic device and it's close to the ears. So I try to be careful in that way. Cervical spine on the side, facet syndrome, laser. So powerful modality, And
what would have been the major difference in terms of maybe something you wouldn't have seen great results with laser that now you feel like it's kind of expanded your scope of care, or you feel like you could do a lot better with that? Because transparently, most of the people who add our technology, probably half of them have a laser or some form of it.
It really helped doing that at first, because I was used to using an electronic tool. I knew anatomy really well, because you have to know anatomy really well in the shoulder and the wrist, and to do this work, And what the difference was, so I had a 96-year-old guy with bone-on-bone hip, could not move his leg. Used a walker, but kind of dragged that leg along. And we did 12 treatments on him, probably the most I've done on someone. Every time he left, he went from a 12 to a 5. Very happy. His daughter, very happy. He's an attorney in town. Not practicing anymore, retired, obviously. And his daughter called me a month and a half later and said her dad was not only out of pain, but he could move his leg. I never saw that with the laser. It brought my hardest cases into a place where I could treat them. But I have another case, and I love telling this story. I had a guy come in. I've been treating him for 35 years. He was one of my first patients. Actually, he saw the retired doctor before I took over his practice. He hurt his back at work. He tried alcoholism, drug addiction, but he would come to the office shaking in pain. He always called it, he goes, "I'm a 15 again, doc." 1 out of 10, he was a 15. He would take the bus back home. He only lived a mile away, and he had to take the bus back home. He would stand outside holding the sign of the bus after his adjustment. So still in that much pain, he'd go from a 15 to an 8 and thought I was the best chiropractor in the world. So this went on for a lot of years, and he came in, I'm like, "Hey, I'm doing a new therapy. You want to try it?" And he was always all in. He walked out of here practically at a 2. He walked home. He gets home, walks back for his next treatment. Let's see, let me think I remember. 3rd treatment, he cleaned the basement of his apartment where he stored his stuff. He hadn't been in his basement for 20 years. Imagine what that looked like. And his friends were like, dude, don't pick that up, dude, because they're so used to seeing him in so much pain. Here's the best part. After the fifth treatment, a guy was pounding on the door of one of his apartment mates above him, the floor above, trying to get into her apartment. He wasn't supposed to be in the house at all. He yells up to the guy and goes, come on down here, talk to me, come on down. Why? Because he didn't remember he could walk up the stairs, because he hasn't done that in so many years. The guy comes down and attacks him, and he beats the shit out of the guy. And he said, every bone in my body hurt except for my back. I love telling that story.
That is the craziest thing.
And he doesn't come in anymore because he doesn't need it. He feels great.
You're a miracle worker, man.
No, I am not. The body's the miracle worker. I always tell people in the office that I'm only a miracle worker because you're a miracle. Because that's what, and it really, like, you see the stem cell migration, you see it when it happens. Like, you're somewhere between for young people, I've seen young people, their first or second visit, you can see by the third visit, they're like, oh my God, I'm like, it starts to work on other things in their body. You see their mood change. You see their, like rheumatoid patients. I only work on one area because if you do too much on someone with an autoimmune disease, they get super tired. So this one woman, I just worked on her hands and her elbows and her shoulders. Almost got like I worked on them. So they're much more kind of sensitive to the immune system because their immune system is kind of overactive in that way. But again, I have hundreds of stories, and
it's incredible.
And I don't promote any of them. Like, I don't have YouTube videos. I don't have any of that because I'm too busy already. It's actually just about to the point where I can handle it. For 6 months, I couldn't handle it, but I did it anyway. I'd work from 8 in the morning till 7 at night without a break. But it's not me. You can be pretty, I always tell patients that too. I said, you know, the machine's dumb, the chiropractor's dumb, your body is what's doing the work. And I attract people, especially from this medical doctor, who don't want to take medication, but they are. They don't want to get surgery, but they are. A lot of people had scheduled surgeries. And again, some of them actually went through, a woman in today, was she in today? Yeah, today. She had a frozen shoulder. We treated her. She painted her ceiling that night. She actually painted her whole house in a few weeks. Then she played pickleball and broke her shoulder. But as soon as she had surgery, guess who she came back to? She came back for more StemWave on the new replacement shoulder. So we see people pre-replacement, post-replacement, which I did with laser, which I did with light therapy. I did a lot of pre and post-surgical work with people because they get better results in therapy. And I'm amazed how, like, I send patients, that's a good thing to do, is when people get results, you give them an article and say, give this to your doctor, give this to your therapist. Like, no one knows about it. How's that possible? Like, how does, like, and patients will say that all the time. Why isn't everybody doing this?
So one of the questions I have for you with all of this, and this is a question we've got, is surely if you're getting all these great results and you have hundreds of stories, which you seemingly do, how hard is it to use? How hard was it to learn this? Like, what was the process like with that? Like, how, talk to us about what you went through, and I guess how you've learned what you've learned now.
It's pretty easy. Like, I was, again, used laser for a long time, so maybe that gave me a little skill set, but the videos were great. I watched these videos. So I watched Dr. Madison work, but he only saw a couple of patients a day. It's not like I saw a lot, but I got an idea of like how to plug it in, how to turn it on, and then I just started working on people, but I got good results, but now I'm like, so I had a woman, a post failed knee surgery. She didn't have more than 30% range in her knee. And I worked on her knee, I don't know, 6-7 times, no results. And I said, you're done. This isn't going to work. Then she came in for her hip, and I worked on her lower trochanter, which I they have these calls every week that I was on a lot in the beginning. I learned a lot from Dr. Barton and Dr. T. So you get so much help in the beginning. It was so great to hear the stories, what to do, what not to do, what came up. And I worked on the lower trochanter, and her knee literally bent. And she was like,
Wow.
holy shit, did you see that? She said that. She goes, holy shit, did you see that? And it took a while to figure out that, holy shit, the lower trochanter, that's connected to something that's connected to her new knee. Like, oh, that's the problem. Well, maybe that was her knee problem in the first place, that it was her hip, not her knee. Yeah, funny things happen, like especially neuropathy kind of stuff. You work on a knee. So I worked on like a guy's knee, and this is not an infrequent thing. I worked on a guy's knee, and he gets up less at night to pee. He goes, does that have anything to do with the machine? I said, no, it has to do with your body. When your immune system is working, it's going to look for inflammation. Well, maybe that inflammation was in your prostate, but I don't treat people's prostate. Now I get people come in like erectile dysfunction. I finally found a urologist in town that I send people to, because I'm not treating that. But they start to look up shockwave, and they start to look up, they're using it for the prostate. They're using it for erectile dysfunction and Peyronie's disease. They're using it in cardiology. They're using it in dentistry. So this isn't some new therapy that has come around. People are using it in a lot of different ways. But the way we use it is orthopedically, and that works out great.
And what about, a lot of the offices we speak with, one of the main problems they have, and it's a good problem to have, but they're so busy. Like they've got a big staff, they've got a big office, they're seeing hundreds of patients, and they're saying to themselves, I know that I need this. I know that I want to do this. I know that I want to help my patients, and I want to get results like Steve. I want to have stories like this, and I want to be able to have that impact. But I don't even know how I'm going to set this up in my office and make this work. I don't have the time for that. What would be your response to that situation?
So I work part-time, and I have a part-time employee, just the two of us, and she's 77 years old. So it can be done like that. But I also work for a friend up north of me who's got a different machine, but an electrohydraulic machine, and they see hundreds of patients. Typically I'll go there, and when I cover his office, but they have someone else in the office doing. I think in New York, the doctor needs to do the exam, do the first treatment, and then someone else can do the treatments. Don't quote me on that, because no one ever gives me a straight answer on that. But in different states, other people can do the treatment other than the doctor. And again, I don't want to seem simplistic. It's not hard. You can rub this over a joint, not know anatomy, and get some results. But if you know anatomy, which this woman who worked for them knew anatomy really well, she actually taught it in community college or something like that. If you know anatomy, you can be so much better at it. And I do not necessarily treat like Dr. Barton or treat like Dr. T, who don't do a lot of the education, or treat like Dr. Madison, who I learned from. I have figured out the way that works for me. I don't just treat the one spot that hurts, which I've seen people do. I've actually seen other machines in action. I went down to University of New Haven, and we treated football players with a machine that's one of the older style machines. Oh my God, it hurt so much. These football players were jumping out of their seats.
Was it the Ostron?
StemWave?
The big device?
Yeah, it was a portable device.
Oh, I know which one you're talking about. Yeah.
And I wanted to see what could this do? And my friend's son played football for them. And 2 out of the 4 patients he worked on were game ready in 2 days. Like I remember when you and we went down to Northeastern, where you went to school,
Yep.
right?
Yeah.
And the trainers were just not that interested with the science. And then one guy had plantar fasciitis, hasn't run much in 2 years. Alan worked on them, and he goes running. Like he ran for 2 miles. And then suddenly we had interest. But until we worked on the students, and some of them were like, where do I get this? I'm like, well, I think your school owns one now. You got to get them to
Yeah, what's
use it.
funny is we walked out there and the athletic director and all those guys, they're like, seems really cool. We're really excited about this. And all the students are walking over going, I need to use that right now. And
Yeah, it makes
Alan's just
noise.
going,
Yeah,
yeah,
it makes
Alan's just
noise.
going.
Do
And
you
by the
have, remember
way,
that? Do you have permission to do this from the orthopedic? You know, it's like students
they
didn't care.
practice here.
Yeah, yeah. Yeah.
But
So that
now
was exciting to see. You know, I've taken
Yeah.
care of some of SU's staff, their women's basketball team staff, and they would love to have it in their school, but their program's run by orthopedic doctors.
Yeah.
And that's not
And
going to
a lot
happen
of
until
that
it
is
happens.
shifting. A lot of that is shifting. I mean, you know, this is private, but I guess if you're on this call today, I don't mind disclosing it. But like, even, you know, many major institutions are adding this. Like this, we just got into our first NFL team who just added this, the Washington Commanders, which you probably know because you communicate with Alan probably more than I do. Alan was there yesterday.
He loves talking about that.
He loves talking about it. He got to train, you know, them, and you know, there's many other institutions. Ben, who's on our team, he just put in the chat, UConn. Yeah, UConn, Alan trained.
And Alan is brilliant. If you want to know something about, like, he talked to these athletic trainers, I was blown away by the information, PubMed article after article with people that the trainers knew their names. I mean, this is not some unsubstantiated kind of woo-woo kind of, this is like I was so impressed with his knowledge.
And that's why we have him on the clinical advisory board, right? I mean, he's incredible. I mean, he's
he's
really
changed
incredible.
the way we treat people over the last year and a half. But again, you got to find a way how you want to treat them. Like, I mean, I respect people. You want to talk to them for a while and do a package. It's just not how I practice. My friends up in Watertown, that's how they practice. They sign up everyone for a package and do all this stuff. But they have a super busy practice. They have 10 staff members. They do decompression. They see a ton of Amish. Like, it works for them. One of the biggest users are the Amish, which you would think, Amish, they don't use electricity. No, they use something that keeps their hospital bills low. That's why they go, because going to the hospital is a lot of money. Got an operation is a lot of money. So this is a huge savings for them.
So as we're wrapping up here, I have a final question for you. And if anybody has any more final questions, now's the time to submit them. So you can submit them in the chat, or you can just unmute yourself and come live and say it if you haven't already sent one. But I guess the final, Sean, was that you? Or were you about to come live and ask a question? Oh, he might have just been coughing or something. But anyways, the final question that I'll ask you is, we have a lot of people who, again, they know it seems like it's the right move for their office. They're at a point where they're running a successful practice. They're really getting good results with the manual therapies they're using, maybe laser, whatever it might be. But truthfully, they've never spent $60,000 on anything in their life, and they're may have only been running their practice for 5 years, 10 years, 15 years. And for them, making that big of an investment is like beyond anything they've done before. And it's a big deal. What advice would you give to those people who are sitting on the edge saying, Stephen, that sounds great, but I don't know if I can spend that type of money.
It was a no-brainer after my ankle. Like, you have to have results on yourself. Why do patients send other patients? Because of results. You know, I've had other chiropractors come into my office and they couldn't do a full squat. And then they did a full squat and then they signed a check and they have a machine. Like, you have to prove it to yourself sometimes, or sit in a practice and watch people transform. Or it seems unbelievable. I worked for this Ayurvedic doctor in India, and I was told he saw 400 to 500 patients a day. And I did not believe it. Dr. Pankaj Naram passed away a couple of years ago. And then I went to India and watched the guy see 400 to 500 patients a day. This seems unbelievable until you experience it. You know, was $60,000, like, did I feel that? Absolutely. That was a big amount of money to lay down. But I bought my second machine a few months later with the profits. I know. I'm trying to, I have a van that I drive it around in.
Your second one.
Yeah, the second one. And I did some work in Ithaca with it. I mean, it's a big machine. You can't just throw it in the car. But I bought this handicap van to move around a handicapped patient of mine. Medicaid wouldn't bring him around, and because I'm a chiropractor in New York. But I did that for him, and then I'm like, oh, I can use this for myself. And I roll it right into the ramp and bring it up and in and strap it in. And I have to tell the story because I think it's important.
Please.
You know, I had a problem with my first machine. Like, I didn't know what was wrong. And a second machine showed up at my door overnight. They overnighted a 70-pound machine in a 300-pound box. I was in business the next day. And so I didn't lose any business because I don't work every day. And they brought my machine back and they checked it out. And then we figured out the problem. It was a problem in the cord, not the machine. I treated some people, a very high-level spiritual teacher of mine. They sent a machine to Florida for me to treat her. They don't have to do that. So the company is super responsive. If I have any tech questions, boom, I get an answer back. But now I'm like good at figuring out, oh, is it the salt? Is it the... And here's another thing that is a big benefit. I take this head. Let me just shut the machine off for a second because there is electricity. So I take my head off. Oh, it's on pretty tight today. I've never had this problem before. Live on air.
You're all good. You got it. You got it.
All right. It's not coming off. So
Watch,
I take the head
nice
off.
and easy.
I walk over to the sink right over there. And I change the water, which I do every 10 to 20,000 waves. And for me, since I treated a lower intensity, my electrodes last sometimes over 100,000 waves. I always joke with patients when I show them it. I say they call this an electrode. If they called it a spark plug, they can charge as much. And they laugh. Like, people can't believe how simple. And the machine, I was blown away. I can run it on a solar battery for 3 days. I ran it on a solar battery for 3 days, used only 25% of the battery because it only uses 60 watts out of the plug. So there's some complex energy distribution stuff that goes to the head. And soon enough, I could figure out all the little, is it my salt? Is it the electrode going, like the electrode gets tired after a while. So you learn how to turn it up a little and change it a little. But I do not run my machine by my patient's pain, which a lot of shock therapy can hurt. I barely have a patient make a move during a whole day. So this morning, I maybe had 2 patients that went, ooh, felt that. I have one patient that calls it spicy. Ooh, that was spicy, But so that's another thing, I think, why I'm doing so well too, is that patients ask, how much is it? Like when they tell their friends, their friends go, how much is it? Is it covered? No, first, is it covered by insurance? That's the first one. Second one is, how much is it? And the third one, does it hurt? My patients say it may be a spot or 2. So that's a real seller too with StemWave, is you don't have to hurt people, get them better.
True. It's true. Well, I'll tell you what, this was an amazing hour for me, and wherever you're listening, I hope this was a great hour for you as well. I couldn't be more grateful for you. All these stories, I'm like so fired up right now. I can't wait to share this with the team and let them watch these stories because they're so incredible. And I can't wait to come out to your office with the camera team and get some of these documented because they're just incredible.
So luckily I have a spare head and cord. So
okay.
If I have to.
You got it. You're all good. You're all good. We know the heads come off and on.
That's so funny. I can't get it off on air live. So I did live radio and TV. So this is like no big deal.
No, it's hilarious. It's hilarious. We don't care. But again, I can't thank you enough for this. So thank you so much for coming on. And I hope this was useful for anybody. And if anybody has any questions, by the way, if you were like still had questions after, feel free to email me. We'll get the questions back to Dr. Steve and we'll get an answer back to you. And again, thank you so much. And have fun with the rest of the patients for the day if you've got any, and enjoy the weekend, my friend.
Oh yeah, I still work from 3 to 6 and I work tomorrow too.
He doesn't stop. Ladies and gentlemen, you heard it here. He does not stop.
Fun.
So,
But I only work like 18 hours a week. So
okay.
not
good.
a lot. All right.
Not a lot. All right. Have
Take
fun.
it easy.
I'll see you guys
All right.
later.
Be well. Bye-bye.
Bye, everyone.